friends, today our topic is glaucoma. So first we are going to see what is glaucoma. When the intraocular pressure of our eye increases, it damages the optic nerve and it also causes visual field defects. So this condition is termed as glaucoma. Normal intraocular pressure is 10 to 21 millimeter of mercury, but in glaucoma the intraocular pressure rises above 21 millimeter of mercury and the intraocular pressure is measured by tonometer. If we do not treat the glaucoma means it leads to blindness because the optic nerve damage is permanent and the visual field loss is irreversible. Irreversible means we cannot gain the normal visual field again. Next to cataract, glaucoma is the second most common cause of blindness. Now we are going to see the aqueous outflow. It happens through two routes, trabecular meshwork and uveoscleral outflow. Approximately 80% of aqueous humor drain through trabecular meshwork and approximately 20% of aqueous humor drain through uveoscleral outflow. Aqueous humor is produced by the ciliary muscle. Then it enters into posterior chamber, then it moves into narrow space, the space between lens and iris, and then it moves into anterior chamber, then it drains through trabecular meshwork. In this image, aqueous production, passage and its outflow are mentioned. Please go through it. Now we are going to see the glaucoma formation. When the trabecular meshwork gets blocked but still the aqueous is producing, so it unable to drain through the trabecular meshwork and the intraocular pressure level increases. It shows its effects on the optic nerve. Optic nerve gets damaged and the visual field gets lost. So this condition is termed as glaucoma. So in glaucoma, when the trabecular meshwork gets blocked but still the aqueous humor production is happening, so the drainage process gets blocked but production is still happening, so it increases the pressure on the eye and it leads to glaucoma. The IOP level is above 21 millimeter of mercury. Next, ocular hypertension. In this condition, the intraocular pressure is an increased level, but there is no any other glaucomatous problems like optic nerve damage and visual field defects. Only the intraocular pressure is an increased level. Next, normal tension glaucoma. It is also known as low tension glaucoma. And in this type, the intraocular pressure is normal or below 21 millimeter of mercury, but there is optic disc cupping and visual field defects occur. Next, classification of glaucoma. It is divided into two types, congenital and acquired. Congenital glaucoma means he has glaucoma during his birth and this condition is termed as congenital glaucoma. In acquired glaucoma, he acquires glaucoma during his or her lifetime. Acquired glaucoma is further classified into primary and secondary. Secondary acquired glaucoma happens due to any other systemic or ocular conditions. In primary glaucoma, there is no any other obvious reasons. It is further classified into primary open angle glaucoma and primary closed angle glaucoma. Next, congenital glaucoma. If the intraocular pressure raised since birth means it is termed as congenital glaucoma. If the intraocular pressure is raised between 1 to 3 years means it is termed as infantile glaucoma. Next, primary open angle glaucoma. In this type, angle between the cornea and iris is open. Look at the image. In this image, the angle between the cornea and iris is open, so it is termed as open angle. It makes the trabecular meshwork passage gets blocking. So due to the blockage of the trabecular meshwork, the aqueous feels somewhat difficult to pass through it. Gradually intraocular pressure rises and this condition leads to primary open angle glaucoma. It is also known as chronic simple glaucoma of adult onset. It is a bilateral condition. Bilateral means the glaucoma affects both the eyes. The risk factors of primary open angle glaucoma. As age increases, this type of glaucoma occur and it affects both male and female equally. Genetics plays a role in this type of glaucoma. Myopic people are mostly affected in this type of glaucoma and black people are more affected in this type of glaucoma. This means it is usually occur in countries like Africa. Next, symptoms of primary open angle glaucoma. At initial stage, there is no symptom. By doing regular eye exam, we can identify the glaucoma. Then there is a progressive loss of vision. Then there is gradual loss of peripheral vision. Headache, eye ache may also occur, and they feel halos around the light. Halos means bright circles or rings around the light. And for understanding purpose, I mentioned the peripheral vision loss and the halos in the picture. Signs of primary open angle glaucoma: optic disc cupping, and there is visual field defects, and anterior chamber depth and angle are normal. Next, closed angle glaucoma. In this type, the angle between the iris and the cornea is too small, and it is also known as acute angle closure glaucoma. Look at the image. In this image, the angle between the iris and the cornea is too small and the drainage gets blocked. At initial stage, when the angle is narrow, the aqueous feels somewhat difficult to pass through the narrow angle, and it creates a pressure, particularly in the posterior chamber, which causes the iris to bulge forward, and it leads to worsen the condition. That means the angle gets closed. So now the aqueous is still producing, but it unable to drain through the trabecular meshwork, and it is a medical emergency condition, and it requires immediate treatment to prevent the permanent loss of vision. Risk factors of closed angle glaucoma. As age increases, this type of glaucoma occurs, and females are affected 4 times more than the male, and genetics plays a role in this type of glaucoma. Asians and Chinese are mostly affected, and hypermetropic people are mostly affected in this type of glaucoma. Next, symptoms of closed angle glaucoma. They have blurred vision, and they too have red eye. They feel headache and eye ache, and they feel halos around the lights. Next, signs of closed angle glaucoma. They have shallow anterior chamber, and their pupil is dilated, visual acuity gets decreased, and the cornea is hazy. I hope you guys understand the topic glaucoma. Like, share, comment for this video, and for regular optometry updates, subscribe Learning Optom in Tamil and English channel.